Welcome to Healing Conversation. It's another installment of us stepping into your mental health. You're right here on TBN, our home of mental rejuvenation. My guest this evening is Dr. Wisani Makhomisane. She is a specialist psychiatrist and she's going to be speaking to us about the journey of motherhood from the point where, as parents, we take drugs to the point where children are being abandoned by mothers. I know it's a very sensitive topic, but we chose it so that we can try to come to the aid of those people who are going through the most, particularly during pregnancies. She's in private practice, and I'm sure she has the wealth of experience to take us through this journey. Welcome, Dr. Wisani.
Good evening, and thank you so much, Alison Tawising.
It's a pleasure having you today. I want us to speak about the recent gathering that you had, and you spoke on psychotropic pregnancies. That was the GP summit that you hosted. And I'm starting there because quite often we see the mental challenges that parents go through, but it doesn't really register where it started.
Yes, thank you very much. The reason why I chose that particular topic was that we have women that do know that they struggle with mental health, that do know that they should be on treatment, and they are on treatment and get better. But the minute they find out they are pregnant, they then stop because there is a belief that any substance will harm the baby. And so I focused on that, and the GP summit was to say the GPs are the people on the floor. They are the doctors on the floor. They are the doctors that meet the whole family. So the choice was to say, let me teach about medication that is safe to use in pregnancy, because a healthy mom is a healthy baby.
It's a healthy baby.
Yes.
Is it safe to say that as a pregnant woman, and I'm saying this based on your introduction of the summit itself, the assumption that as a pregnant woman I should stay away from all and every medication is not necessarily to my benefit or the benefit of the baby.
Yes, that is very true. So I like to say that the mental illness itself is teratogenic, meaning is harmful to the baby when a woman is not on treatment. And to explain that is that if we are to use an example of depression, when you are on antidepressants, usually after a while you'll probably be on one drug. And you are stable on that drug, you know, if I stay on this, I am fine. What tends to happen is that if you stop your treatment when you find out that you're pregnant, there's a very high chance that you will have another episode. And because pregnancy has a lot of hormonal ups and downs, which is part of the pregnancy, that puts a woman at risk of having an episode. Even the ones who never had a depressive episode before the pregnancy, the pregnancy itself puts you at risk. Now, when you stop, chances are you'll have an episode. And when now you come severely depressed or depressed with psychosis, now we have to use 2 or 3 or 4 drugs just to contain you. And then now that puts the baby at risk. And that is why I say the illness without treatment is more teratogenic to the baby than 1 or 2 drugs at the most.
Let's speak about the people who are now pregnant and suddenly, without any previous diagnosis, find themselves facing depression or any mental health unwellness. And this is an issue because with most women, we don't pick up that we are actually depressed because the symptoms of pregnancy and those of depression are in a way similar.
Yes. No, that's very true. I think because depression is quiet, depression is silent, depression does not talk. If you think of the other conditions, for example, the bipolar, when someone is manic, or the psychosis or schizophrenia, the behavior is out there. Everyone can see, and they can see this is not in keeping with Alison Tawiseng. Depression is quiet, it's silent. Women suffer in silence. So you might not be able to get out of bed. We won't know. You might not be able to eat. We won't know.
And we say, yes, she's tired because she's
pregnant. She's pregnant. We assume when you're pregnant, you're unhappy, you're moody. You are tired, you're fatigued, you can't get out of bed, you're emotional, you might cry. So even when you try and say, Austin saying, I'm not myself, it will be, but you're pregnant. That is normal for pregnancy. So women have depression for most of the 9 months and they don't get to know because it is assumed that is what is normal. And that is why it's actually very important that we screen. Because when you don't know, as Alison Type is saying, that this is depression, someone else will not pick it up. So we need to screen so we can say to you, you are at this level, you are at high risk. Then we sit with you and we go through the symptoms to say, that is not necessarily pregnancy, that is most probably depression.
You have a study that you conducted as part of your master's studies, and you were investigating the relationships between the drugs that are taken and the mental health. And I don't know if I put it correctly. Just share with us a bit on that.
Okay, thank you very much. So my master's was more actually mental health and HIV. And I guess that will include the drugs that we take in HIV. You find that we, as especially in our communities, in our rural communities, there is a lot of stigma around HIV. There's a lot of stigma around mental health.
Yes.
Now, if me as Wisani, I have to attend the HIV clinic on Wednesday and then attend the mental health clinic on Friday, it's almost like I'm double stigmatized.
Yeah.
So I end up not going because it's the stigma. Now, the idea of that research was to say, can't we have a one-stop shop where women come in? There'll be the doctors that follow up the HIV. There'll be the doctors that follow up the mental illness. And if needs be, the doctors that follow up the pregnancy. Because then it removes stigma. I'm just going to clinic on a Wednesday. It doesn't matter what I'm going for. Then I will go there, take care of my baby, take care of the HIV, and take care of my mental illness. And yes, that was the part of the research. And it was also looking at rural communities. Because we have a lot of studies in South Africa that are more urbanized.
Yeah.
No one comes back to say what is happening in Gamulepo. No one comes back to say what is happening at Ilim. It's more what is happening in Johannesburg, what is happening in Durban. Yes.
And those are the areas where it's very hard to get the sympathetic ear that one needs. Because with mental health, one thing that leads to the fear and the shying out of openly speaking about it is the lack of compassion. So in rural areas, there is the lack of education that makes it difficult for us to even understand that a pregnant somebody can be depressed. So how does really one, besides dealing with the stigma, but also encouraging the compassion, the compassion side of it?
I think the biggest thing is understanding, for example, what mental illness is, what is depression. Because what would happen, Alison Type is saying, someone will come and say, you're married, you're working.
Yeah.
Why would you be depressed?
Yes.
You're driving a car.
Yeah.
Why would you be depressed? And I think it's important for us to come back and teach the chemical part of the depression, to say, I don't have to have an abusive husband. I do not have to be unemployed to be depressed. I can have the perfect life, but I have a chemical imbalance in my brain that puts me at risk of the depression. So I think when we understand what mental illness is, that it is a chemical imbalance. And I think that's the reason why, as a psychiatrist, I have to train as a medical doctor and then go specialize in psychiatry, because I need to understand the chemicals in the brain and how to rebalance them. So I can come back tomorrow and say, you look beautiful, you are amazing, but you can still be at risk of depression. Yes. So the compassion should come from there to say, it doesn't matter what my life looks like.
Yes.
I can struggle to get out of bed because chemically I am unbalanced. Yes.
Let's talk about the postpartum. It's alarmingly, out there, and most people are coming out and saying, I've got I have postpartum depression. And how related is that to depression that one suffers during a pregnancy? And a follow-up question to that is, Is it possible for me not to be depressed during a pregnancy, but pick up postpartum depression?
Yes, I will start with pregnancy. We actually say half of the depressions that people experience after delivery, which is postpartum, actually come from pregnancy. So we'll say 1 in 2. Of the 2 women after delivery that have depression, one of them had depression in pregnancy. And we say one of them because, in all fairness, sometimes we miss the other one. It's likely that it started in pregnancy, but it was missed because we will say the symptoms are similar. But there is something else that happened. You know, I like saying when a woman has a baby, it's like your body has gone to war. You literally create a human with bones, hair, eyes, blood from nothing. So we undermine the process that a woman's body has to go through in that 9 months, because you literally build a human, you know? And so there are hormones that are there to protect the pregnancy, to make sure that you do not lose the pregnancy. The day you deliver, they crash fall like this. And the body does not do well with crash falls. It likes sloping up and sloping down.
Sort of a preparation.
Yes, of something. But the minute,
going from, having and just having in smaller dosages to ultimately not having the support mechanism hormonally.
Yes. Example, how we'll stop medication. We will not stop medication. We taper down and stop. But when you deliver, it's like someone switches off a plug somewhere to say these hormones cannot come anymore. And that, I will say, messes around with the chemicals in the brain. And that's what puts someone at high risk of depression. So that's why postpartum depression is actually more than the pregnancy depression, so to say. But something else about postpartum depression is that it's not the usual depression. Because the usual depression, someone has a low mood, they lose interest in things they used to enjoy, maybe they don't have appetite, they struggle with concentration, and they're indecisive, and so forth. I think most people have an idea what a usual depression is. Postpartum depression is harder, it's different, because there's the depression that I've just mentioned, but there's a lot of anxiety attached to it. And we like saying that depression is hard, anxiety is hard, the combination is tough. So an anxious depression is very hard to manage, because it's almost like you get up, you're almost on edge, like something is going to fall. But with postpartum, it goes beyond that. The other thing is that during labor, whether it's a cesarean section or it's a normal labor, as much as we assume it's normal because our grandmothers have been having kids for decades, it's actually a very traumatic experience, Whether you hear another woman screaming, or you go with fears that I might not come back with a baby. There's a lot of trauma that happens there. So now a woman has depression, they have anxiety symptoms, they have these trauma symptoms of surviving labor ward. And I say surviving because you went in, you came out with a baby. But there's also the almost like obsessional thoughts, where even when you want to rest and say, I've put my baby in the cot, my baby's sleeping, something will come into your mind to say, what if your baby suffocates? What if something? So when people come and say, Austin is saying you should sleep when your baby sleeps. You should rest when the baby rests. You can't do that, because when you want to rest and you want to sleep,
the anxiety kicks in.
Comes in to say, what if you forgot to change the nappy? What if the baby bends? So it's almost as if for 24 hours a day you get up, you're on edge. And for me personally, that is the reason why I appreciate our culture. Because our culture originally used to say, when Alson Tabiseng has a first child, she goes home.
So you have the support system.
Of
you have
women who have gone through this before. If not home, maybe your mother-in-law, but there has to be an older woman who looks after you. Then the older woman is supposed to say, rest, I'll watch the baby. Then you will not worry about suffocation in a cot, because the grandmother of the baby has the baby. And unfortunately, the more urbanized we become, the more we are very far from family. So even when Austen Tabiseng has a child in Polokwane, in town, to get to the old ladies in the family, it's too far. So we end up doing it by ourselves. We might have the help in the house, but now I have to put the child in the cot and I have to rest. But the mind comes in to say, what if? And that actually adds on this risk on top of the chemicals. Now you have all these mind problems that adds onto the chemicals, and that's why it's very risky and it's high risk for a woman after delivery to have depression.
And what is the, besides having the issue of a great support system in place, what helps one really navigate their way through postpartum depression, if there is ever such, a clear charting, way to chart forward and say, to deal or try to cope better. This is what one needs to look out for or do.
I think we need to start by telling women it's okay to have a healthy baby and still be depressed. Because what will happen is when Ausen Tabiseng tries to tell me to say, hey, I'm a bit sad, I'm struggling, I'm going to say, do you know 1, 2, 3, 4 people that went to maternity and did not come back with children?
So be grateful.
Be grateful.
Why are you complaining?
Yeah. So we need to start by saying you might have a healthy child, you might have a perfect life, but chemically it is okay for you not to feel okay because the brain is the brain and the brain has its own chemicals.
Yeah.
So we need to start there. I think the biggest support is to say, it's okay. Call for help. Do say, I have a healthy baby, but I am not well.
And that it's also okay to call for help.
Yes.
You are not a failure.
No.
In any way.
No.
To say, I need help, I'm not coping.
Yes, no, that's very important. But I think also the daddies and the husbands, sometimes because Ausen Tabiseng works, she's a lawyer, she does this, she's a pastor. When you're at home during maternity leave, sometimes your partner can think you are doing less work. So you should be fine because usually you're very busy. And now we need the fathers to come and understand that, number one, you're from war, 9 months and then the baby. Number two, as much as you are moving around less, your mind is busier because now you're looking after Ausen Tabiseng and the little baby. So instead of saying Ausen Tabiseng has to cook, Ausen Tabiseng 2 days after delivery, Ausen Tabiseng has to cook, has to wash the kids' clothes, has to do this and this and this. We need to say you're from war, rest. Someone should cook a warm meal for you. Someone should wash the baby's clothes for you. Someone should say, let me hold the baby so you can sleep. We need to start there to say, let's allow you to rest. After that, we say, even after rest, if you're not okay, it's okay not to be okay. And I think for me, that's why I love primary health. Primary health, I mean GPs and the nurses in our clinics, because those are the ones that see a human being in totality. So as much as you're going for your 6 weeks immunization, they know to check you, the scar, or the if you didn't deliver via Caesar, your health. And then after that, they check the baby. And then after that, they then have the room to check on you mental health to say, how are you doing? And as much as I'm a specialist and I love being a psychiatrist, we should never forget primary health care because that is where Ausen Tabiseng goes with her child together to make sure both of you are fine. And it starts there. And sometimes we undermine like the clinic's ramulepo, to say, well, I would rather go see a specialist. It's okay to see a specialist, but it is that nurse ramulepo who will know that I need to check Ausen Tabiseng, I need to check the baby, their health, and mentally, how are you doing? But that is the people that also know you from when you were 5 years old.
Yes,
so it's easy for them to pick up, this is not the Tabiseng that I know. Something has changed, and they're able to ask and find out how you are. And I think that is the best way to support our mothers. Yes.
So Dr. Wisani, with the postpartum and the fact that, the surrounding environments are very key in helping the mother get into the best shape that she can be after delivery. Are there facilities that are saying, we are here, we are available for those people who don't have that support structure at home? If I'm in Durban and my home is Ramolepo, And of course, I love my grannies and they are there, but it's going to take me quite some time to get there. Are there institutions which are rising to fill in the gap? You know.
Yes, no. I like saying that in my lifetime, I hope that there will be a day where even in private practice, when you enter to go see your obstetrician or your gynecologist, you'll find a mental health care practitioner. They are coming up, but we are not where we should be. Even in public sector, there are those where they are now coming together because as healthcare practitioners, we are learning the importance of mental health. So to answer your question is that the places are there, but they are not enough. If you look at the number of babies that are born in a day, the places are not enough. But I think shows like this, Alcentabi saying, says to someone who's sitting at home saying, I have a need, I have a burning fire to do something. I went through postpartum depression. I wish I could help. I might not be a psychiatrist or psychologist or a doctor, but I wish I could come up with a facility to assist. Shows like this will help that women say, I can do that. They can reach out to healthcare practitioners and we can support them. But help build somewhere where a woman will know that when I go in with my baby and I say, I can't, no one will judge me. They will understand that I cannot. So I'm hoping that from this show, more and more women will say, let me rise up and start this in my small communities. Because we need to learn that no one will come from far to come and help us. It needs to start here. It needs to start in the small village where one woman says, let me do this for my fellow sisters. Yes.
On a parting note, what would you say to someone who does not see the need for prenatal care? And I'm saying this with specific focus on the mother. Not on the fetal, because we tend to we do prenatal care so that we can make sure that our babies are born okay. But what about us going through the process mentally okay?
Yes. I think the one thing that we were always told was that our great-grandmothers were giving birth at home with no follow-up and they were fine. But a lot has changed. Even the food we eat has changed. So we are not as healthy as our forefathers used to be. It is very important, even before the mental health, physically, to know that you are at the best part of your life to carry a baby. There are certain micronutrients that we might miss. When they give you multivitamins, we usually feel, I don't feel like taking it, I won't take. But our food, because it's so processed, sometimes it misses certain things. And that the health of the mother, because healthy mom, healthy baby, the health of the mother has to come in. But after that, then comes the mental health. Because for me to be able to get up in the morning, brush my teeth and bath and take my multivitamins, I have to be mentally stable.
Sound,
Yes, to know that this is important for me and my baby. So I would say, honestly, you need to go and seek help. The help is there. You need to go ask, because sometimes you don't know that you're not unwell. You're not well. You assume you're fine because that's how you've been. Especially in our communities and our history as a country with apartheid and all the trauma that happened. This is what we call generational trauma. Trauma can actually change your DNA. And that we now carry trauma that we don't even know we are carrying. And we pass it on to our kids because we do not seek help to actually put an end to the trauma, to say, I received it from my forefathers. It should end with me. Yes. So women should seek help.
There you have it. I think that in this discussion, we have not really, covered so much in depth of what mental health is during the pregnancy state. My prayer and my belief is that with just having scratched the surface, it communicates one vital message to you. Your mental health is integral, and that starts with a healthy pregnancy. Don't overlook your emotions. Don't overlook what you may attribute as mood swings and just say, I feel moody. Have yourself checked out. It may not necessarily just be pregnancy symptoms. Your mental state may be at risk. It's best you check it out now so that you are able to recover and have a healthy baby. God bless you. Join me again for part 2 with Dr. Wisani.
Get yourself a copy of our latest books, The Mending of a Broken Vessel and Maintaining Your Joy, a journal for daily positive living. Visit a bookstore near you.